Aloha. I'm Dale Rosenfeld, moderator of Conscious Cannabis Conversations. I'm an advocate for cannabis, and this podcast is designed to educate you. We are not doctors, although we do have a cannabis nurse with us, cannabis nurse Wendy. We're not giving medical advice. We're giving education so that you have a better understanding of what we're doing, what we're advocating for, how we're all looking to help. Coach Chella has been helping many, many people. She's an amazing woman who has had a lot of experience in this area of dementia and making sure that her family has access to all of the medical cannabis and hemp-derived CBD. There's a lot of issues surrounding it. Dementia is one of the ones that we know that CBD, that cannabis is helping people with. Coach Chella has a huge book that she shows people that has all of the case studies for dementia. Coach Chella, would you tell us a little bit about some of the issues that are surrounding using cannabis for dementia and what your experience has been?
Sure. Thank you so much, Dale and Nurse Wendy. Thank you. We learned the hard way that cannabis helps dementia when my mom was diagnosed with Alzheimer's in 2010. We didn't use cannabis at first. The doctor said, "Oh no, don't use marijuana. It's bad for her memory." And I'm like, I only know like a couple things about Alzheimer's. I was in my 30s at the time. And I knew that it was bad for your memory. And so I'm like, okay, whatever you say, doc. I thought he knew better, right? So we muddled through for about a year before we really started using cannabis medicine. And at the time in California, that's where I live, at the time, we only had access to pretty much just THC products in the medical dispensaries because it was only legal medically at the time. And so I went to the dispensary to ask them what I needed to do. What can I get? What can help me with my mom that I could put like in her shake? And they, showed me this teeny tiny bottle for like $100. And I'm like, yeah, that's not going to work. I need like enough medicine like every day, several times a day. This is like a thing. So they gave me this giant bottle of olive oil that had been infused with cannabis. And at the time, there's no regulation. I had no idea how many milligrams was in it, but I tried it on my mom. And boy, did it work. She was clicked into her body. She was able to enjoy her day. She was able to eat food that I made for her on a little plate. She was able to interact with her family. It just eased all the really hard symptoms, the aggression, the agitation, the psychosis. CBD and THC, in fact, are in the United States Department of Health patent 6630507B1, and it's specifically for cannabinoids, both CBD and THC, the study, for recovering from stroke and head trauma, as well as neuroprotection from Alzheimer's and Huntington's, Parkinson's. It's in the patent. Now the patent's
Can I
expired.
interrupt you?
Please join.
Quote that patent. So the Department of Health and Human Services took out this patent in 2003, which shows that the 5 cannabinoids that they tested had neuroprotective and antioxidant properties, useful in minimizing brain damage from ischemic stroke, and also useful in the treatment of, they use the words treatment of Alzheimer's, Parkinson's, and HIV dementias. That's the patent.
Yes, ma'am.
When did that patent come out?
2003, Department of Health and Human Services.
Over 20 years ago, we've had that patent.
Yeah.
Yeah. And my mother's doctor, her neurologist in 2010, had no idea. No clue whatsoever. And they still don't. They still don't. And the book that you talked about earlier, this is the book. This is my mom using cannabis oil. These are the studies, and the first study is that patent. So yeah, this is a thing, and it really does help. Now, a high THC protocol might be right for some people in small doses, but other people might need CBD and THC. And some people might do really, really well with that hemp-derived CBD, like that 20-to-1 idea that we talk about. So it just depends on the person and the symptoms that they're exhibiting. Dr. Ethan Russo did an excellent review article in 2018. That's when I kind of really discovered like real healthcare professionals know about this stuff at a big, huge conference called CanMed, and it was at UCLA, and they had a panel on Alzheimer's. And then of course, Dr. Russo was also presenting this study that he released. And in the study, he talks about the gut microbiome and seizures and brain tumors and a whole section on Alzheimer's disease. And in the Alzheimer's disease section, he breaks out which cannabinoids and which terpenes are helpful for which symptoms. And it's incredibly beneficial and super duper helpful. And, unfortunately, there are some facilities that do allow this. And in California, we have a law that technically guarantees people 65 and over with a chronic condition like Alzheimer's access to medical cannabis, even in care facilities that get Medicaid funding and stuff like that. Except in practicality, it's hard.
That's the Ryan's Law?
Yes,
Yeah.
Ryan's Law.
And
Sorry.
We tried to pass a similar bill a couple of
Mhm.
years ago, and it
Mhm.
got killed immediately, and we're going to try again next year.
So
Excellent.
what you're saying, Wendy, is in Hawaii, that bill did not pass.
That's
And what
right.
you're saying, Chella, is that it is a bill, it is a regulation in California.
Yes, it
And-
is.
Okay. And it's not always followed.
Correct.
As
Yeah.
I see it, all of this research that's not being done is because it's still in a Schedule 1. And as soon as it moves into a Schedule 3, which we're hopeful will actually happen, even though it's been passed, we don't know that will happen yet. That will allow more research and maybe make it more gentle on the administrators.
I think they'll be a little less resistant to having it on in the facility, and we're going to struggle to allow healthcare professionals to be able to administer it.
Well, if it's on the Schedule 3, it shouldn't be a struggle.
Yeah, it'll still be a struggle.
Well, it shouldn't be.
What makes
because-
you say that, Wendy?
Because the schedule is only for prescription drugs, and it will never be a prescription drug. So they can administer only FDA approved prescription drugs.
They also administer health supplements.
Well, if we could get it scheduled as that, but that's not a possibility because
It is right now a possibility. It's the federal government is accepting our testimony right now about how they should schedule it. So right now is the time to write the DEA and submit your comment for federal reclassification. I have submitted testimony to deschedule cannabis.
That's the
because it
preferred.
should be.
That is how it should be. It should not be in the Controlled Substances Act at all. Never
Correct.
belonged there, never will, but
Yes, we all
stuck-
agree. We all
stuck
agree.
there.
Well,
Yeah.
we need to
Well,
submit our testimony, right?
Where do you suggest that we submit that testimony besides just generally DA? Is there something specific?
Yes, we will have it in the notes of your podcast here today, a link to submit that testimony. We only have 14 days left to submit that testimony. It's due very, very soon. So people
July
need to get on it.
22nd.
Yeah. Yeah. Thank you, Wendy.
Say that again, Wendy.
It's due by July 22nd.
Right.
Okay.
So yeah, you'll have the link for that, and we will all submit our testimony to deschedule cannabis And we'll see what happens. Listen, we have to submit it, whether they do it or not. I mean, I think it's going to be a battle just to move it to Schedule 3. But
Yeah,
as someone
it
in
is.
California with a family full of people with dementia,
Mhm.
no matter where it's scheduled, I'm getting it to my loved ones,
Mhm.
you know? And Sativex is a 1-to-1 oral mucosal spray that is legal in 30 countries.
Mhm.
Wow.
So it's ready to be put on the, go through the FDA process when cannabis gets off the Schedule 1, wherever it lands. So there is a possibility to have this medicine, have something that could be on a formulary.
Okay, yeah.
And
if you
people
have
do,
Sativex, that would be
yeah.
huge.
And people do have an option right now to use hemp as a supplement, hemp CBD as a supplement,
Okay.
and get a prescription of Marinol. That's another workaround. You have to be super creative.
Marinol is not a synthetic, or
Oh,
it
it's a
is.
synthetic,
It is.
a
So
prescription synthetic.
will it go away once,
Oh, no.
if the bill
No.
gets passed?
No, if the
Oh, no.
Miller Amendment, no. It's that's an FDA approved drug.
And it is in a Schedule 3 category already.
Right. So there you go. So that's another option for people to take, is get hemp recommended by their doctor, hemp CBD recommended by their doctor, and then use the Marinol as the THC portion. We find THC in small doses to be very, very helpful in lieu of the deadly black box antipsychotics that are commonly prescribed to people with behavioral problems in
Mhm.
dementia.
Mhm.
And my dad was prescribed a FDA approved for agitation and Alzheimer's antipsychotic that killed 8 people during the
Mhm.
clinical trial.
Mm. Wow.
Wow. Did you reject it?
Of course, yeah. I mean, I picked it up from the pharmacy and I read the insert and I'm like, I can't do this. So I did something else. I changed our protocol a little bit. I added a little more THC. Because our podcast, Cannabis Helps Dementia, we interview lots of doctors and researchers about what they're doing. And Dr. Babak Baban out of Augusta University in Georgia did a study on these 5 FAD mice, which are the familial Alzheimer's disease mice. They're the worst off possible little mice. And when he receives them, they were adults and they were running around in little circles in their cage, and that's how they would self-soothe. So when he got these little mice, he started injecting them in their bellies with the human equivalent of 300 to 400 milligrams of CBD. The first day, they stopped running around in circles and they started living more normal mouse lives.
Wow.
And they did this for 2 weeks, and then they had to sacrifice the mice. And they looked at their brains, and their brains that were genetically programmed to have holes in them had neurogenesis.
Wow. They were
Growing
healed.
back. Growing. Wow.
And it was buried, it was suppressed by the mainstream media because it's the same year, 2021, that the infusion that causes brain bleeds in people with Alzheimer's came out and is FDA approved.
Hmm.
Yeah. So
We've
we do
been
something
fighting
different.
dementia and Alzheimer's and all of that for so long. I mean, it wasn't even really diagnosed until the 1910s, 1920s is when the first identification of it as not just being the fugue and people just being vague.
Senile.
Senile, yes. So now here we are over 100 years later, and still trying to figure out not just how to help prevent dementia, which there's research on that, and it's not getting very far. They think they may have found a drug that if you catch it before you even know you have dementia, you might be able to stop the dementia from occurring. Well, that doesn't help it in any way. But there's no real research so far on how to eliminate it once you have it.
Yeah,
And this is a choice.
Yeah, Dr. Dale Bredesen does have a lot of information on how to prevent and reverse dementia through non-pharmacological interventions. Dr. Mikhail Kogan, a geriatrician in Washington, D.C., practices Dr. Bredesen's protocol, but he says that 80% of the people just can't stick to it. He also uses cannabis. I think that if you use cannabis and Dr. Bredesen's protocol, which is basically a healthy keto diet with intermittent fasting, which is something we can all do, it's super beneficial for most people. And we can push off dementia with that. He has several studies and books about this idea. And as one who is extremely concerned about this possibility for my own brain, I'm totally counting on CBD and cannabis to help me, along with my clean diet, exercise, and intermittent fasting.
So I asked a cannabis clinician who's a cannabis expert also, about which cannabinoids are neuroprotective, because the patent only looked at 5 of them, which included CBD and THC. And she said all of them are. And there's about 147 cannabinoids in cannabis. So if you look at that, and there's probably other neuroprotective agents in there as well, in the terpenes or the flavonoids.
Which is why I prefer to call it adult use as opposed to recreational.
Sure.
Because anytime you take cannabis, you're helping yourself.
Yeah. Yep. Wow, ladies, thank you so much. This has been a conscious cannabis conversation. The more that we learn, the more we can share and make a healthier life for ourselves, for our relatives, for our loved ones, for the whole world. Thank you once again. What else do you have to say? Each of you give us anything, last words.
Thank you so much for having me. Cannabis Helps Dementia. You can check out the podcast. We have a little book. Go to coachcella.com to find all of our offerings. And please send your comments about the federal rescheduling and lean towards descheduling, please.
Wendy, anything last to say?
Yes, cannabis can and is part of a healthy lifestyle. It can be and is, for most people who use it. Do so in a way that is responsible, doesn't hurt themselves or other people. That's actually a quote from the Department of Health and Human Services in their effort to change it to a Schedule III drug. They stated that it is not a public health, it's low risk to public health.
Well, I know it helps me. I'm 71 years old. I walk 3 to 5 miles every day, and I am determined that cannabis will help me not have any dementia. I will look forward to it being descheduled. Thank you once again. We'll see you again for another conscious cannabis conversation at another date. Aloha.
Aloha.
Aloha.